Please mute. Oh God. Who are the people disturbing us? Please start your introduction. Agbese.
That Agbese also enable the slides. Let him enable it so that it can be clear. If you look at
enable your slide. Enable your slide, yes, so that it can be clear. I introduce.
Yes, better.
Good. Introduce. Agbese, you are two here. Shut down one, or maybe you have issue.
Yeah, I'm doing that.
Mute. Let me see. Which one can we mute for you? We have muted one.
Yes.
So, okay. You are even three. So please, run his resume. Just compact his resume so that we can move on. Oh, Agbese is Dr. Agbese is our moderator today. Agbese, oh yeah, we have gone online now. Agbese, we have gone online.
Good morning. My name is Dr. Tassan Agbese, your moderator today. And we have a topic, poultry flock coccidiosis, by our presenter, who is no any other than Professor Musa Usman. He's a professor of veterinary medicine and chief consultant in avian clinics. Usman Danfodio Sokoto, veterinary pathology and postgraduate.
Agbese, your network is not good.
Research Institute, Bonn, Plateau State, C and VCN accreditation panel to Joseph South and the University of Ilorin, respectively. He has served for many years as an external examiner in the Department of Veterinary Medicine, Veterinary Pathology, and Veterinary Public Health and Preventive Medicine at the Ahmadu Bello University, Zaria. He is also an external examiner for postgraduate degree program at the Department of Veterinary Medicine, Yakubu Gowon University, Abuja. Professor Musa Usman graduated from the Ahmadu Bello University, Zaria, where he obtained the Doctor of Veterinary Medicine, DVM degree in 1992. Certificate Poultry Feed and Feeding India Master of Science, MSc degree in Veterinary Medicine in 2002. And Doctor of Philosophy, PhD degree in Veterinary Medicine in 2009. He also holds a certificate from the Center from the Carter Center, USA, and was awarded the fellowship of the College of Veterinary Surgeons in 2018. In addition, he has attended several professional training courses in avian medicine, laboratory techniques, poultry production, and management, both within and outside Nigeria. Furthermore, he served as consultant to numerous poultry farms. He is the author of the book Quail Production in the Tropics. Professor Musa Usman is a member married blessed with children. Thank you, Professor. You're welcome on board.
Thank you, Agbese. Yeah, am I good to go?
Yeah, good. You're good to go.
Okay. Thank you, moderator, Dr. Agbese. My chief, I don't know, the Oga Kwata. I will not have you this time around because we have started the business. Thank you, the audience. You are all welcome. Today, I know it's a busy day. I'm not going to take much time. I'm going to go straight to the point. After all, coccidiosis is a well-known disease by many poultry, I will not say poultry doctors or other things. Everybody that is in livestock and poultry production must have had or must have encountered coccidiosis. So it is a disease that is well known by many farmers and even non-farmers. The local poultry people knows about it. The commercial people, poultry people knows about it. The various students knows about it. So here I'm just going to highlight some of the few things to remind us on the effect of coccidiosis on poultry flock. So in the course I'm going to, apart from introduction, the outline is, I'm going to talk various methods you diagnose coccidiosis and what are the various treatment options we have, and what are the prevention measures and the control measures that will take to minimize the effect of coccidiosis. Can we go? Yeah. Yes. It has various number. The common one we say cocci. The moment you had a veterinarian or a poultry specialist, animal scientist calling that my chicken has cocci, it means coccidiosis. So it's another synonym for it. And it is an intestinal infection caused by coccidia belonging to Emeria species. These are which are transmitted by resistant oocysts. And the major things is the severe enteritis, because it's a gastrointestinal disease when we talk of coccidiosis. Major pathologies are in the intestines, and that's what gives us the clinical signs we may likely to see, and which we are going to discuss. So it's highly contagious, and it is spread through the ingestion of contaminated feces, and it thrives in warm, damp condition. So there must be a moisture there for the oocysts to sporulate. We don't expect to have coccidiosis much problem in some desert area like Niger area where the moisture there content is very dry. So the incident may be less than what we are having in Nigeria. Even in Nigeria, in the north, in the northern part of Nigeria, we may likely to encounter less coccidiosis than in the south, because here we have more drier environment than the southern part of the country. So what I mean is associated with moisture there, and is associated with the warmth there, the heat there. So it parasitizes the epithelium and sub-epithelium with the intestinal tract, as earlier mentioned. It is caused by two genera, Emeria and Azospora. Emeria infects poultry, and the species include E. tenella, E. asabuline, E. maxima, E. necatrix, all those things are shown on the screen. They are the main Emeria species of coccidiosis. There are other species that affect different types of poultry. What I'm saying, there's Emeria species that affect turkeys. There's one that affects ducks. Ducks, or I mean DUCK. There's one that's specifically for chickens. So it is, as I would, it is host specific. Yeah, specific. That means the Emeria in chicken is not likely or will not cause a problem in turkeys. There's something Emeria and turkeys will not cause problem in sheep and goat, and so on. So what I mean, each host or each species of bird has its own Emeria that affects it. The other ones, what I say is basically disease of intestine, but there's one that we call renal coccidiosis. This usually goes to the kidney and other things, which I mentioned there. It's usually disease of young poultry. Mostly, if you see the impact of coccidiosis, is mostly related to young birds because they are more affected, but adults also can be affected, especially those who are on DIF litter. So if we see higher mortality as a result of coccidiosis, it's mostly encountered in young birds. The adults are also infected, but the mortality may not be as high as what we encounter in young birds. And as I said, also chicken, turkeys, dog, geese are susceptible. But as earlier mentioned, also they are affected by specific Emeria species. Yeah. Yeah, let's continue. Agbese. Yeah. So like I said, I earlier mentioned that they are host specific. And mostly I said it's occupied the segment of intestinal tract. It is common disease. It's all over the world. You encounter coccidiosis all over the world, provided the chickens are there. You find coccidiosis. In adult birds, mostly, as I said, the mortality may not be as high as in the younger birds. But you notice there's decrease in egg production, performance, and other things. So, and even mortality in adult birds. But mostly what we notice, you find that the chickens are not dying. They may pass in, please tell him to, in addition, it can be complicated with some bacterial agents, because as I told you, the pathology is mostly noticed around the intestinal tract. And the moment the epithelial lining of the intestinal tract is affected, other organisms that opportunity may get easy access to enter the systems, and it may cause problem. We can have bacterial agents such as Clostridium papyromices and the like, that you have a concurrent infection with coccidiosis. I earlier said that it's worldwide. You can have coccidiosis all over the world where the chickens are raised. It's possible to encounter coccidiosis, provided the conditions are met for development of oocyst. So it is transmitted by droppings and contaminated litters. Yeah, if you also notice, as I said, this lecture, the essence of this lecture is to remind us on the havoc and the causes and various ways to control coccidiosis. But if you look, the major mode of transmission is from the droppings and contaminated litter. And we do remember that birds raised on battery cages encounter less coccidiosis or will not have coccidiosis compared to the birds that were raised on DIF litter. So, and most birds that were raised on DIF litter are small flock or are small, farmers that have small flocks that raise them on DIF litter. If you look this season, the rainy season around my place here just started. Around the southern part, it might have started a long time ago. And this is the period that we have major major incidence of coccidiosis. And the moment, especially those birds on DIF litter, the moment they ingest it. Sometimes also what I want to tell you, if possible to have coccidiosis on battery cage, in bird cage, rear on battery cages. How does that happen? we have this habit of raising the chicks or the pullets on diff litter. Then later when we are selling them on as a point of cage or point of lay, those birds that were raised on diff litter and you purchase them as a point of lay, you took them to your, if they are having those oocysts, it's likely you see some signs of coccidiosis, because it's from the diff litter that they were infected, and you carry and place them, even in the same farm. The ones that were raised on diff litter and they have coccidiosis. By the time you transfer those birds into battery cages, you'll see that you may have some clinical signs of coccidiosis on those birds in battery cages. So normally what people do is after transferring to battery cages, you deworm the birds for intestinal parasite. At some time also you can give anticoccidia to knock out any remnant Emeria species that are parasitizing the birds there. So the infected birds animal shed oocysts in the feces, and after some cycle develop like, they have one good thing about coccidiosis, they have a lasting immunity. As long as the bears keep on being infected, the bears develop immunity. And through that, you say that they have some level of protection from the infection, especially on that same species. If it is different species, the protection is not confirmed on various species. What I mean, the immunity to Emeria tenella may not be an excuse for the other Emeria asabolina or brunetti or whatever. Yeah. They say. So this one I already explained. I said challenges or challenge with different species will lead to infection and disease depending on the number of oocysts. So what I mean, even if the bears have immunity to E. tenella, if E. Emeria necatrix, the bears ingest different oocysts of Emeria or sufficient number of Emeria necatrix, they are likely to come down with the disease. So what I'm trying to say, one cannot protect the other. There's no cross protection between species. That's the summary of it. What are the signs we'll see? As I said, also, these are very common. The farmers, even the diploma students, and able-bodied veterinarians, young veterinarians, and other things, they know the clinical signs of pollution. But I'm going to remind us also, we have decreased food consumption. If they are adult birds, their feed consumption will decrease. And definitely because of the disruption of intestinal line, we find that absorption of food, if they consume the food, is not there. So that would lead to egg production, decreased egg production or meat quality. We have diarrhea. This one, it comes in different forms. You see, sometimes we have bloody diarrhea. Sometimes we have whitish with some little blood there. Sometimes we have watery, or sometimes we have mucoid diarrhea, depending on the Emeria species that is infecting the birds. But most common, if you see bloody diarrhea, is called by E. tenella, E. necatrix, and E. maxima. And mostly they are the cause of what we call cecal coccidiosis. So that's what you will see differentiate between them. Then, of course, the bears is not well kept because they have decreased food. The feathers will be ruffled. And dullness and weakness, I know, are the main sign. Any animal that is sick is most likely to come dull or to be weak. Living things that are sick definitely will not be very active. So we have weakness, dullness, and other things. Then you see them huddling together. Sometimes, and another thing I want to remind us here, if you have an outbreak of coccidiosis, because of the decreased immunity or depression of immunity, you see this parasite that the bears can cough with will come up. And sometimes if you have gumboro, you see that by the time you take sample to lab, or you see that such birds will also will be showing signs of coccidiosis because of the pressure of immunity as well, gumboro. So also the clinical signs, sometimes you see they mimic the gumboro because gumboro also is disease of young birds. As also earlier mentioned, coccidiosis is also disease of young birds. So sometimes young veterinarians confuse gumboro and coccidiosis. It's possible you have concurrent infection, gumboro with coccidiosis. But sometimes you have to look which one is the main thing there. If not, you'll be losing the focus. So huddling together, you see, just like the way you see it during gumboro outbreak, you see the birds also huddling together. Of course, we say that decreased feed consumption, we say that loss of weight. And because of loss of blood, you see shanks, big skin become fail. You know, it become fail because of the loss of blood. Yeah, we can move on from here. Yes. So lastly, we'll say that we can have, if there's higher infection, you can have acute death in coccidiosis, especially in those one caused by cecal coccidiosis, as well as Emeria tenella, Emeria maxima, and brunetti. And the moment you start seeing the sign, so the poultry farmer has to carefully tell the attendants, always when they are, especially here, I'm more concerned about those who are on diff litter, especially when the attendant is feeding the birds or giving them water. Let him carefully be looking at the fecal droppings. Once he notices any blood there or any abnormal pieces, he should tell you as a veterinarian, who should report, so that action can start immediately. Because one thing, you know, in poultry, when the birds are completely down, even if you put medication in drinking water, they don't have energy to drink the water so that they can get cured. Of course, you know it's coccidiosis, but the birds are very weak, and you put necessary medications, but the birds were not taking water. As a result of that, you see the effect of medication will not be achieved. So in that case, so let prompt attention to your management, enlighten your farmers to pay prompt attention to management, observe any signs that they think is abnormal, especially when it comes to fecal droppings, so that treatment can start immediately. And what are the lesions you see? Here, as I said earlier also, we have two types of coccidiosis, intestinal coccidiosis and cecal coccidiosis. If you look at the anatomy, I think as we go, you'll see various areas I would like to talk. In cecal coccidiosis, you see that petechial hemorrhages in the intestinal area do occur. You'll see the ceca become swollen, sometimes filled with unclotted blood. Sometimes the ceca there look like intestine filled with sausage. If you know sausage, it's just like something was blood there solidified inside the cecal area. And with this, you know, especially during the postmortem, what do you mean by postmortem for our non-professional colleague? Is the birds where it died, you are doing clinical examination of dead bite. And by the time you go to those cecal area, you see that it's filled with unclotted blood, which form like a caseous plug there, like sausage. If you have known what is sausage, it's going by. If you look at the content there, it become reddish, you know, as a cook blood there. You can, so this is the ceca there sometimes thickened and with extensive areas that can easily be sloughed off. Yeah, we can, let us move. Agbese. Yes, intestinal coccidiosis is mainly caused by E. necrosis, and you see some hemorrhagic spots in the middle portion of the small intestine. You can see also some numerous pinpoint red white spot may be seen from the serosal process. Just remove the fecal content there. By the time you little bit wash it, you see the hemorrhages I'm talking about. The place being spotted with some hemorrhagic points there. And one thing I would also like to bring to our notice that most of the time you can have combination of cecal and intestinal coccidiosis together. So most of the time, it's not having separated one and other things. Sometimes you can have one, but what I'm saying, by the time it reaches the cecal coccidiosis, it causes more higher mortality than the intestinal one. But in most cases, you can have combination of the two, the cecal one and the intestinal one, all occurring at the same time. And when you are treating, you treat all the same. Well, the same thing I mentioned, as well. This one you see upper portion of that one I told you is in the middle of the intestine. This one you see the upper portion of the intestine. But all these ones, you know, to a farmer is just English, because what the farmer is after is for this is best to get well. That's what he's after. He's not after whether it is cecal, intestinal, or other things. What the farmer is, but for academic purpose, you may like to know which species are you dealing with, because the good thing is that most of these drugs affect the chemicals we use in terms of treatment affect all the species of coccidia organisms. So here, but for academic or as a professional, you have to know which type of Emeria are you dealing with. But to a farmer, his concern is which drug will you give his animal to get better. That's what's concern of the farmer. So sometimes it's very devastating, and really this thing you can see heavy infection and other things. Continuation E maxima also causes that. This one is lower. You know, it depends, as I mentioned earlier. Sometimes upper portion of the intestines, lower portion of the intestine like E maxima, and in actually the middle portion of the intestine. As I told you, as a veterinarian, it's good for you to know you are going an advanced step by knowing which exactly may likely cause of that lesion. Yes, of course, we are dealing with coccidiosis, but among the Emeria you are dealing with, you know which Emeria is likely causing the problem. But as I said earlier also, the
Usman, you're frozen. Hey, oh God, why are we? Usman has crashed out. Oh. I'm trying to call him.
Okay. Yes, it was his network.
can you hear me, please?
Yeah, we are hearing you now. Thank you.
Okay. Let us move. So all those one I mentioned, let us move. Agwese.
Agwese, move your slide. Thank you. So you can be explaining. Don't worry, you can be explaining.
Yes. Okay. So what we are still talking about different types of coccidiosis. So you see what I'm trying to say, intestinal and cecal. So the first picture by your left, you'll see that how devastating it is. You see, as I said, what?
Just continue.
Yeah, as I said, you can see how devastating it is. you are seeing a blood there, heavy enteritis. I mean, you are seeing that especially in E. tenella, caused by E. tenella and E. necatrix. As I said earlier, also it can be mucoid. It can be whitish mucoid with some blood tinge and other things. Sorry. So you can see all those things. Then we can see sometimes, depending on the area that is affected, you will have all those things that are there. I'm coming. So when it comes to, I don't know whether we'll go further.
Yeah, can you share from your side?
Yes, that's what I'm trying to see if I can do it. Is that what I'm seeing? I'm trying to do that. I'm trying to do that from my side. I'm trying to do that. Oh. Sorry, I'm just trying to see. Okay. Okay. Maybe I continue with the explanation. I try. It's not going also on my side. So what I'm saying here, you see, what I'm trying to say that you have like this dysentery type of diarrhea there, you see, and you can see sometimes it's mucoid, sometimes on. So it depends on the color of the diarrhea, but also tilted towards the type of Emiria species affecting the birds. The hodlings there, the pictures are there for you to see later when the slide I share to you. And you'll see that the anemia appearance or anemic appearance, you see that's an anemic appearance of the intestinal organs. Then I wish we can share this. Sorry. Yes, let us see if I can. Okay, yes, we are back now. Yes. Are we together, Chief?
Yes, more than together.
Okay. So you are seeing what I described earlier, the areas or the zone of the intestine parasites. You see, this one is upper portion of the intestine in case of E. acetylene. What I'm saying, these informations are for professionals, not for farmer. A farmer, his interest is his birds are sick and they have coccidiosis. He may know that it's coccidiosis, but at advanced level, you know which type of Emiria that is infecting the birds by merely conducting the post-mortem examination. Can we go further? Agbese? Agbese, you are having problem.
He's there.
Yes. So the same thing, still on the same thing, you are seeing if we are having E. maxima. Here I'm just, the drawings there are just to show you which area of the intestines were parasitized, which areas were parasitized. Can we continue? Yes, the same thing. If it is the most pathogenic actually are E. necatrix and E. tenella and maxima. Yes. Necatrix, tenella, and E. maxima are the ones that are mostly pathogenic type that cause higher mortality in chickens. Can we continue? Yes, so for the thing that we're talking Sika, I don't know that you are seeing my distance. These two things are Sika. These two, that's two bifurcation at the end of intestines. That's what we call Sika. And you see the content, this one, when it was open, you have seen how the contents are bloody there and the other things. So this type of coccidiosis is more devastating than other types because this one is caused by E. tenella or E. necatrix. So are the main cause of this one. The other ones are not as devastating as the other species, but this one really are the one that causes it. How do you know it is coccidiosis? How do you know it is a coccidiosis that affecting the chicken? You examine the feces for the presence of numerous oocysts. This one is in the laboratory. You can go to the laboratory. We have various methods. We can know that it's a coccidiosis. There's exploitation methods. There's other type of methods that you can do. But as a veterinarian in the field, if you have a microscope, you can easily take intestinal scrapings. You can take intestinal scrapings and put the slide, on the cover slide and other things. Sorry, gentlemen, they can hear you what we are talking outside. Yes, and this is internal. Okay, sorry, I'm stopping some of the colleagues that are here also to listen to the lecture. So examination of the feces, you can do that in the laboratory. And the last one we discussed is about postmortem examination, which will say a number of dead birds or sick birds, you can post them to see this lesion we have discussed earlier. And the intestinal scraping, you can also do that. And you can also do a histopathology to know the affected portions. And you can do cross-immunity tests. All these are various methods to see. But actually, as Alshe mentioned, the first step to do is to see the physical examination of the birds, to see that, look at the fecal colors, and look at the appearance of the birds, look at the scenario, look at the environment, look at those things. Through that, or from the history, you can make your diagnosis. Then history, physical examination, you can make your diagnosis. Then you can go for clinical science, which you mentioned earlier. To do clinical science, you can make your diagnosis. Also, the next one, you can go to the postmortem examination. Also, by those birds that are dead or moribund one, you can post them to see various lesions as described earlier. You can make your diagnosis. Then the last one, to make a confirmatory diagnosis, you can actually take your intestinal scrapings to the laboratory. You can identify, isolate and identify, or you can identify the oocysts there. So all these are various methods of making your diagnosis with this thing. But as I said, even a pen attendant, by the time he saw the birds passing below the diarrhea, he may start suspecting. If he's an experienced attendant, he may start suspecting that these chickens are having coccidiosis. There are so many diseases that you can confuse with it, and differential diagnosis, which include necrotic enteritis, which e-brunetis shows similar signs what you observe in necrotic enteritis. And histomoniasis also, you can have this thing because of the lesion you see in the cecal area and other areas. Also, because of the higher mortality, you can also confuse coccidiosis with Newcastle disease. Also, you can confuse this with Gumboro disease also because of the appearance of the chickens. Treatment, there are various ways you can treat the disease. That's where you can treat disease. Let us move. You can use the, we have two types of anticoccidia. We have anophos and we have chemical synthetics, the one that are synthetic. And this one, they all help to build a natural immunity. We have monacin, which we have coban, salicylomycin, and lysocid. All these one are available in Nigeria because I use them in the fast. They're all available. Some of them are, most of them are feed grade, that there's also milling their own feed. All they need to do is to follow instruction and mix their anticoccidia drugs, and the chicken continue picking it at particular dose, and sometimes the bears may likely get immunity. And the chemicals ones are the mostly ones that are sold in the shelves here, and small veterinary pharmaceutical shops. You find different types. Proleum, which is the common one that is there, mostly everywhere is there. There is a new generation, which is sometimes we have gone even to fourth generation anticoccidia. So trazuril, diclazuril, and all those things are first and third and second generation anticoccidia, which are also very effective. And this one I just tried to give example from one of our book, textbook of veterinary medicine by Falaudu and myself. We just pick what is there and I put it here to share with you. So these are some of the prescription that you can use for some anticoccidia drug. But most of the time, by the time you purchase any drug, look at the instruction and just follow as manufacturers directed. Of course, sometimes you can make some adjustment to make the treatment very effective, but just follow manufacturers' directives and they will solve the problem. Acetyltrazuril, diclazuril, these are third and fourth generation anticoccidia. They are also available in the market. But as earlier mentioned, they are mostly feed grade. They are not sold in small sachet and they are only used for feed millers. But this one that are water-based that you give, especially people with smaller flock, there are so many types on the market. Even sulfadimidine, but sulfur use now is, say, banned or is not allowed. But also sulfadimidine, sulfameras, and all those things, they are effective also against coccidiosis. But because of their residues in the meat and egg, it is discouraged for us to use them. But they're also effective against coccidia. How do we prevent? Mostly, as I said, indifferent litter is a major problem, but try to avoid the spillage of water on the ground. And in case, if there is spillage of water there or damp litter, please try to change and distance. And after treatment, it's good also to remove the litter. Or even after brooding. Some people ignorantly may brood chickens and say this litter because maybe of difficulty or scarcity of the wood shavings, especially during the rainy season. They'll say, okay, this one we just remove them, we can continue the brooding. Please, it's not advisable. And overstocking is also another predisposing factor to coccidiosis. The more you overstock your birds, the more the litter or the frequency of the litter degradation happens. So what I mean, if the bears are a normal stocking density, you see that if you are to change the litter in 1 month, it will take you maybe 6 weeks or 2 months to move. But if that's over stocking density, the litter that you have to wait for 1 month to change, you find that in 2 weeks' time, the litter have already started caking. So that means you are wasting more money of going to get more litter and all that. So stocking density, not only this thing, it will predispose best to coccidiosis. And the ventilation is very important. Even if you have right stocking density, if there's no good ventilation, the litter, I mean, cake very fast. And drainage also, especially my brothers and sisters around the south, where the rainfall is high, make sure you build your house with good drainage system. Even here in the north, you have to build your house with a good drainage system, because when the water log is around the area, the water seeps from the ground off and wet your litter, and which you can predispose the best to coccidiosis. And always treat your outback. Do not starve your best. Give them adequate water and other things. Let us move. And you can do what you call nowadays that this method, especially those one with higher population of birds, there are various methods you can use for those one with bigger farms. You can, instead to use this drug, which is very expensive, you can opt for using vaccination. Some for chest vaccination birds, because there's new technology now that the hatcheries vaccinate the birds against coccidiosis right from the hatchery. So some bigger farms purchase such birds so that they can run away from frequently using anticoccidial drugs. And especially those who are keeping breeders birds. And okay, let us continue. Agbese? Yes. So, as I said, the pit grade anticoccidia, this one, you are continuously treating the birds, or the birds continuously taking the anticoccidia till when they are moved to cage. That means if you are compounding the feed and you are putting the anticoccidia in the feed, with this one you have continuous protection against coccidiosis. And for the one using smaller sachet, we have amprolium, which you treat, and you can also give intermittently. You can use a 3rd week, 6 weeks, and 9 weeks. And you can use it once per month, depending on how bad or how waterlogged or how your management system is. But if you have a good management with everything, as I mentioned earlier, there's no need to continue abusing the drugs by giving them drugs all the time. But if your management is sound, you can only use the drugs when there's need to use the drugs. Basically, let us move. Basically, yeah. Yes. So there's other type of treatment we call switch or shuttle program to develop resistance. As I said, continuous using of anticoccidial drug may likely, predispose best to resistance against particular species of Emeria. So this one, what we call switch or shuttle program, you use. There are some other things that you use that after treating, you stop for some days. For example, you draw drugs for 5 days. You switch to another type of anticoccidia, because we don't want a situation where continuous use of single or particular anticoccidia the best will develop resistance. So you interchangeably use different anticoccidia drugs, especially if you are using 2. You use this one for particular time, then the second time you use another one. Or the issue you switch after some days, you give another one. Like in the one with smaller flocks, we use diabetes to either you, treat the best for 5 days stretch, or you treat for 3 days, then give 2 days pre-drinking water, no drugs, no medication, then continue after 3 days, making it 6 days. Or you continuously give them for 5 days as stretch. And immunity, I have wanted to touch this one, but at smaller surface, is acquired immunity we're having. And even within this, depend on the manner of immunization. There are so many things that affect the immunity against coccidiosis in chicken. One thing is the age of bed. Second is the size, intervals between intervals that you are immunizing. Agbese? Yes. So resistance to the infection on the same species of immediate after recovery from infection has been observed. So what I mean here is if there was outbreak due to E. maxima or E. tenella, and the bears recover, so for them to get infected again with those species, sometimes it's not possible. Or even if it is possible, sometimes it's less occurrent, it's rare. So what I'm saying, they develop acquired immunity through that previous exposure to that same organism. But as I said earlier at the beginning of this lecture, one species will not protect another, and there's no species that protects the other type. So the vaccines now, I use vaccines once or twice in my career. In those days, I think, I can't remember, is it Anmeka or what, that are selling the vaccine, Hemocox. So I used it once, but sometimes it's used with some conditions that you have to follow. The common vaccines, all these ones are available in Nigeria. Hemocox, I saw it in Nigeria. Sometimes I used the Hemocox in those days. And it is live vaccines that you have to give it. But one thing with those, there's method to use in administering those vaccines against coccidiosis. So maybe later as we go on, this is another type of vaccine, Cocciplat R is also coccidiosis vaccine. Let's move. So how do you administer this one? I said, provide uniform exposure and flock immunity. So that means all the bears supposed to be exposed to that particular vaccine. The one I mentioned earlier in hatchery, they can spray gel, they can do that in obo administration, injected directly in about 18 days in the hatchery is very good. And I don't think in Nigeria we have started using it in obo vaccination. I don't think, I'm not sure, I don't know, I'm not current with those things now. But I don't think in Nigeria we have started giving an obo vaccination against coccidiosis. But the common one now that are available is the use of Hemocox or Hipparacox. They have been sold in the Nigerian market, although not widely everywhere you get them, but they are effective also if you follow what according to manufacturers' direction. Then the common one the small farmers are using, or the backyard farmers are using, is drinking water or medication or feed medication. You don't, using those anti-coccidia drugs or after vaccinating, you don't use drugs also to treat coccidiosis because you are killing the organisms there. Then sometimes after vaccination, just like a typhoid vaccine, sometimes after vaccination, you have what we call post-vaccine reaction. You'll see some clinical signs of that organisms inside the, among the birds. So this, but after that, you see there's birds typically develop full immunity within 14 to 21 days post-vaccination. And litter management is very, very important. I keep on emphasizing that management is very important, especially litter management. It's a specialized area of poultry management. You have to train your pen attendants very well how to manage the litter. Show them the importance of having a dry litter, good litter, and other things. There are many things that affect the litter. The dust, we have dusty litter, we have cake litter, we have, so many things, waterlogged litter, and all those things. Some poultry houses, if we enter, we find that are they soaking the wood shavings or not? Especially if the house were not constructed properly. The splash of water will easily get into the houses and the birds are there. So litter management is very important. Where to purchase, how to manage the litter before putting inside the room, after putting inside your fan. How do you manage the litter? Before putting inside your fan, how do you manage the litter? So all those, not only for coccidiosis, for other things. So we have some other references that or requests. I didn't have much time to put them on you, but when I request, we'll do that. With these things, ladies and gentlemen, I thank you for listening, and thank you. As I wait for your comments, contribution, questions, welcome. We are here to share the knowledge together, not only on my part, even of you. So we can share, we can discuss about it for the benefit of our farmers. Thank you very much.
Thank you, Usman. Once a professor,
don't have the see you don't start again.
Professor Usman is not only an academic professor, he's a practical professor. You see him in Lorry, you see him in Abuja, consulting firms. At his spare time, he lived with birds at VOM, MVRI. I don't think, if you want to catch him, if you
don't let his wife hear. I have three professors here with me. They are listening to the lectures.
If you want to see him in VOM, just go to the poultry house. You must see him. I don't know when he eats. Maybe he carries his lunch box to the farm. So that kind of a person talks from introspection. He's not talking from hearsay, no, he's talking what he is seeing. And that practicability inside him, he has demonstrated it. I find it difficult to make comment because times I try to pick one thing. By the time he had made one or two statements, he has erased that thing I picked. So there's no need to ask him questions. That is, please remove the share. That's the practicability of this young man. Most times you talk to him, he said he's in the field with his students, that I should wait, not in the classroom with his students. So he moved them. You have a PA, senior special assistant. Somebody is with your hula. So does it mean that?
Yeah, what I'm saying, I have two or three professors.
Does it mean that? Okay. Adamu, see, I've seen Adamu. Oh, sorry, Adamu. Sorry, Adamu. Adamu is your senior special assistant.
Yeah, senior special assistant.
For his cap, his cap must be smaller than your own, or you sack him. Or you sack him. See, Adamu, for a long time, Adamu, you still recognize me.
You are forgetting me now.
He was the MVMA chairman when I was MVMA president, MVMA chairman for Sokoto. But that's okay. You can see the personality. We are looking for personalities like him, honestly, to come and address us and address our mind. But be it as it may, I have some few points to raise. In using vaccine, has to be very careful, or that vaccine will fail you. Not that the vaccine is not good, but the rules tied to vaccines, they are too much. You must.
Yeah.
So in my farm, because after practicing poultry medicine, I decided to set up a farm. What we normally do, because we'll find out that first 1 week, they are not vulnerable to coccidiosis. And we started to research into literature. We found out that the enzymes that digest the oocyst must come up active before those oocysts are digested for coccidiosis to take place. So what we find out is that between the first 2 weeks, the vulnerability is so low. But as you start mounting the stage, it becomes highly vulnerable. And he mentioned one thing here. And that vulnerability is at the time of Gumboro disease. That is a very fantastic. And then because of that, if you don't take time, during Gumboro outbreak, because of immunosuppressive aspect of IBD, you have coccidiosis. That's it. So what we do in my own farm those days, but you have to be very mindful, because if you put coccidiosis starts, and then you put vaccine like a Gumboro vaccine, Newcastle vaccine in drinking water, you will compromise those vaccines. So we make sure that the point we give the anti-coccidia is not the time we are vaccinating the birds. We must give the anti-coccinate to strategically break the cycle of this malaria. And break it once. That means, malaria is a cycle.
Yeah.
Eh? It's a cycle until you get to the what do you call the there's one statement for it. They have the schizogony,
sporozoites.
Thank you. I'm talking about, there's one name for it. The mitotic stage, and the sexual stage. So the sexual stage and the mitotic stages. So if you're able to break those cycles, you will not have it. Some people are trying to use cage all the while for preventive purposes. That means from day one, they have different categories of cage. From day one to lay, they have cages for brooding, cages for rearing, and cages for laying. But I have seen a literature whereby, one has to be careful, whereby, because when you are using such a mechanism, the immunity, the immunity of coccidiosis is cell-mediated. And being that the cell is cell-mediated, it is graded. It is graded, that means it goes up, continue, graded, that means a staircase. That's a staircase phenomena, like you are climbing staircase. If you put them, they don't have immunity. Any small outbreak can take them off. But if they're on the, and that's what the vaccines are using. The vaccine are using with attenuated vaccine. They won't get to pathologic stage, but that you are taking it and dropping it, and getting their oocysts, you are picking the oocysts, then start cycling, and as you are cycling, in fact, they are revaccinating themselves. And that's why it's very difficult to clear the litter. If you clear the litter during vaccination, you are in problem. And then when you are in cages, be very careful, because some formites, house flies, I have seen warehouse flies in some literature that were able to transmit the coccidia oocyst, attaching to their legs, and they'll be flying about and sharing it. So what we do, one, strategically, this is what I've done, and it's been very hopeful. Then another strategically break with coccidiostat, because if you use coccidioside, you are not getting graded immunity. You are killing them outright, and you are stopping the immunodevelopment. Then another thing I am trying to figure out, yes, by the time you see adult birds having coccidiosis, birds in lay or about to lay, rest assured that those that have slow growth, like if the laying age is 1.8 kg, they will be weighing maybe 1 kg, or in fact less than 1 kg. Meanwhile, they're old birds. Most times when coccidiosis strikes, is those ones that are affected. The big ones, they have passed through a lot of metamorphosis that at the end of the day, their GIT ecology will not support after coccidiosis. So anytime you see coccidiosis in old birds, look at them. More especially when they're in litter, you have not caged them. Look at them, is the smaller birds. They know those that could not grow. Those ones are the ones that will have coccidiosis. Maybe I will leave. And then when you talk about Innovo vaccine, I don't think there's any. Let them vaccinate Marex first. Those that are very important.
Actually, in Nigeria, I don't think we have
let them vaccinate Marex first. Leave that one. And then I have not seen Innovo vaccines where they have the vaccine. They are moving the eggs in the embryos in the eggs, and they are vaccinating them when they're inside the embryo, inside the egg. I've not seen it. I'm yet to see it done. Even we will soon bring you here. You must discuss fowl typhoid for us. That's another disease of great concern. We need to talk about CRD and fowl typhoid. All these what do you call it? All these vertical transmitted diseases, right from parents to grandparents to parents to commercial.
Yeah.
So we have a lot to deal with on this as far as poultry is concerned before we move into jumble into some areas. In the next 2-3 weeks, we'll deal with fowl typhoid. It's a very difficult disease in this country. And it's clearing a lot of flock. And then CRD, these two vertical transmitted diseases. You said something about dealing with different strains. And from what you have presented, they are specific to certain areas of the intestine, down to the ceca.
Predilection sites.
Yes, the predilection sites are specific to the strain. With the ones that are mostly available, Asaphulina, yes, I've seen it scantily. Nicatrice is the one you will pray never to see. It's very, very difficult. It's a killer, and it's very difficult to control. The easiest to diagnose and control is Tenella. In fact, it's the most common. In terms of pathogenicity, in terms of being common, among all these strains you talk about, Tenella, first, and it's very easy. Just go to the balloon, the seeker, open it, you see core, you see congealed blood.
Yeah.
Yeah, as a core. So that's it. The most of the drugs we have tried and tried and tried and tried. I think the best combination is I don't know about any other person. The sulfoquinoxaline and prolium. And prolium is and prolium alone. And prolium cannot prevent much, cannot treat, cannot control much. But with sulfoquinoxaline as a synergist to amprolium, I think they perform wonders. That's why my own
Chief, the use of sulfur now,
yes,
because of the tissue and the egg residues, discouraged now.
Okay.
But actually, as you said, they are very, very good, effective drugs sometimes. So sometimes we have to wait. If you look the withdrawal time for such drugs, no farmer will produce maybe 500 crates, continuously throwing it out for maybe they told you that withdrawal time is for 3 days. That means, do you discard 1,500 crates of eggs? Some Nigerian farmers really where? So really, they are very effective.
I've lost out of since I lost my farm to banditry. I ran away before they will kidnap me. After stealing my chicken, their workers can arrange for you to be stolen. So the best thing to do, I don't even practice vet medicine again because I'm a trader. Maybe I've lost touch some certain reality. I've lost touch to certain reality. So please, we expect some comments so that we can move forward.
Yeah. We give room for participants. We have to.
If you want to participate, if you have any vital information, raise your hand, please. Or pass your comment. If not, we'll shut down.
I'm trying to.
Now, but be it as it may, we have some big heads here. We have Dr. Uloma Urapa. Women these days, they don't want Mrs. to be attached. Hello? They don't want Mrs. to be attached to them anymore. In fact, if you're lucky, if they answer your surname, or if they don't add their surname, they don't add their surname to your surname. So now we are coming into the time for feminism. Part of the resultant effect is that they don't answer Dr. Mrs. or Professor Mrs. or Barrister Mrs. anymore. Just call them Dr. This, and then your name they are answering is enough. We have Dr. Uloma Urapa, former permanent secretary in Abia State. We have Dr. Mali, immediate past director of vet services for Benue State. They are all here.
Benue State.
They are all Benue State. Please, whoever is echoing this, please. That I don't know if Usman, if you bring some, at times you bring some commissioners from Sokoto, we can recognize them. Yeah, please. If there's any special person here, so that they don't think we overlook them.
Yes.
See Adamu. See he can't change his face.
Yes, he is still active.
Well,
I have the. Well, I have a not online. I have a former director of veterinary teaching hospital, Usman for the university, Professor Adamu, who is on sabbatical at Ahmadu Bello University area. He's here with us. We have others that have left. They said no, they want to listen to the lectures, not this. Maybe later they subscribe on the distance. On the channel. They came here personally to listen to the lectures and they have left. Okay. We have Dr. M.S. Saad. He is also by side.
I don't see that. That one, is he invisible?
No, he tried to be by side.
Maybe he's an angel.
Okay, let him, he's coming.
Is there in spirit? Hey, I thought you are spirit.
Good morning.
Okay, you're welcome, man. You're welcome.
Thank you. I'm not a poultry specialist. I'm small animal practice. But I've learned a lot here.
You say it's what?
Small animal practice.
Oh, small animal
I'm
practice.
a small animal practitioner.
Okay. I hope your patient will not eat our patient.
I raise these Belgian guinea fowls.
You raise what?
Belgian guinea fowls.
Oh, Belgian guinea, beautiful, beautiful.
Yeah, so that's why I said I want to listen.
Yeah, you can see that you see, one thing you get today is that they might not have coccidiosis because the strains, the birds will have prevalent here, the chicken, and they don't cross.
No,
in fact,
they do because last year I had to treat.
You had to treat. Really? Okay, maybe because of the local geese all over the places. We're not hearing you.
What I'm saying is I have them. They roam around within the backyard.
Okay.
So last year I had to treat because they came down with coccidiosis, with the bloody pieces and all that.
Really?
So that's why when he was up,
how old are they?
Yeah, some are about 2 years, some are about 1 year now. Now with the rainy season coming, I felt I need to listen to this discussion so that I would also have the experience of handling the problem when it comes again, or try to prevent it.
Okay, okay. I hope you had enough. Or do you want to hear more?
I've heard enough. No, he's my classmate. He was my classmate. So
at Ahmadu Bello University.
We're always together.
Okay, yeah, well, but you didn't follow him to MVRI.
No, we finished area together. Then he went to MVRI. I came to Namfudu.
No, I knew he went at MVRI when he was a bachelor. We were calling him Usman.
Yeah.
Okay, that's okay. Please, if there's anybody that has something to say, let the person say. So that we can.
Let them unmute.
Clara wants to speak.
Yeah.
Clara, you unmute yourself and talk to us.
Good day, Prof. Good day, everyone. Thanks so much for this beautiful lecture. I must confess I really learned a lot from it. But sir, I would want you to throw more light or a kind of give us advice in respect of this challenge of withdrawal period for, for some of these anti-coccidios or for coccidiostats now, because we need to do we need to leave some period before the product can be consumed. So I want you to advise, which drugs will you recommend, for people that are practicing, since it is a challenge to discard some of these products because of their finances. Thank you, sir.
Okay, thank you. I think Agbese, maybe you have to unmute all so that if they want to ask, some may not know they are
No,
muted.
no, we can unmute. Don't worry. If you unmute, some of them, it can rebound.
Yeah. What you said, withdrawal time is very, very critical. And as earlier mentioned, no farmer, even most of the drugs, they have withdrawal time. So the only thing you can use is to use the one that have less withdrawal time. So you find that withdrawal time is even for 21 days. And you cannot discarding the product for 21 days. So use the one that are safe, that have less withdrawal time, and are not having higher residues in the product. For example, amprolium doesn't have much longer withdrawal time, but when it comes to a devastating or serious, highly pathogenic organism like A. tenella, you find that amprolium may not be sufficient enough to knock out quickly. But you can use this new generation of anticoccidia like totrazuril or declazuril, which sometimes you just treat for 2 days. In fact, if there's heavy outbreak, you use that declazuril or that is, it will quickly wipe out the organisms there. And sometimes there's no withdrawal time, sometimes it's very low, depending on the type you use. And the only problem with that third generation of anticoccidia is that's the infection occurrence of the disease. I use it personally. You have serious outbreak, it works like magic. You treat, the following day the bears were okay, and you just treat for 2 days, and
which one? Which one?
Totrazuril or declazuril.
Declazuril, okay.
Yeah. So you use them, you find that it wipes out the organism quickly. But after 2 weeks or 3 weeks, we start having another set of problems again.
Yes. I think we have mentioned why.
Yes, I mentioned. Yes.
They don't set up cell-mediated immunity.
They don't set up immunity.
So
that's major problem. So, but if we are rearing broilers, 4 weeks, 5 weeks, 6 weeks, you have disposed them. So in such situation, it's not for longer use. You use them, no withdrawal time. You use them, you push the best to the market, and solve the problem. But if we are using layers a long time again, you find that you have to look at water. Sometimes also for eggs, for the adults, you also use the one that, because you take measures, the management will make you use antibiotic or anti-coccidia less with good management. So that's what I'm saying. So you look, but what I advise all the time you are buying, look at the sachet on the drugs or the label on the drugs. You'll see the withdrawal time and the use their discretion appropriately.
Yeah, but the withdrawal times are on the label, on the product level.
Yeah, that's what I'm saying. Most of the time they are on the level.
And most of the time is 72 hours. Most of these common and most of them are 72 hours. But the shortest withdrawal time, like this is this current generation of anti-coccidia, like declazuril and
totrazuril, yes.
But they have their limits, which we have just mentioned, because of the immunity.
The infections and all that.
Yes.
Yeah. So thank you.
Yeah. Thank you so much, sir. Thank you.
Are you satisfied, Oga, Madam?
I am, sir. I'm satisfied. Thank you.
Please, when you ask questions and you are not satisfied, tell us. If we can't answer it, there are some people around, or at worst, we'll Google right here in front of us and get you the answers. Or we'll go to ChatGPT, AI.
I'm satisfied, sir. But that means if we're using this new generation drugs, we'll have to be repeating, their use often.
No,
since they
what I personally advise. Okay, Usman answered so that I will use my experience.
Yes, they said once bitten, twice shy. Today you have outbreak of coccidiosis. You use the drug effectively, it works. So using drugs alone will not solve the problem 100%. So you intermarry it with the good management. I earlier mentioned ventilation, I earlier mentioned water spillage, I earlier mentioned so many things, overstocking density, all those things. So we have to look what is the problem that you keep on having the occurrence of such problems. So you try to remove those factors that encourages the development of coccidia disease there. So when you put two combinations together, use of drug and so there's no need for you to continue using the drug continuously. Try to minimize or to manage your environment very well so that the use of drugs will be less frequent than when you are. But when the conditions are always there, definitely you always have problems. Continue using the drugs. So that was saying good management and good administration of drugs will minimize the use of drugs.
I think he has answered it very, very well. Are you satisfied?
I am, sir. Thank you so much.
Okay, good.
So without any further questions,
yes, I want to make comments, sir.
Okay.
Yes. First and foremost, I want to appreciate you, Professor, for this wonderful lecture. In fact, this is my area. I specialize more in poultry. Ever since I came on board as a veterinary doctor, I was drafted. In fact, I did my IT in NVRI, where I got hands-on experience on the poultry farm there. And
maybe I left. Which year, sir?
2006, sir.
2006. I left NVRI 2013 after working for 21 years.
Okay. Yeah. So the first place I was posted to was a very big farm at Delta State, Crown Feed and Livestock Nigeria Limited, Iseluku. And in fact, when we were in class, we were not taught anything about vaccination in coccidiosis. But outside the field, we stormed over Hemocox, which was then distributed or imported by Animal Care.
Yeah,
that vaccine was, yes, that vaccine was something else. Very, very potent in the vaccination of or control of coccidiosis in poultry.
Yeah.
But over time, I wonder what happened. That vaccine is no longer in circulation again.
Yes,
And
it's no longer really.
If the management of Animal Care can revisit this particular product, Hemocox, it gave me a very, very good record and success in that farm. I was opportune to raise 350,000 birds in that farm, and the coccidiosis was zero using Hemocox. I never used any drugs in raising those birds. The batch of these birds comes in 30,000 each. And I raised up to 350,000 birds in that farm with a good 100%, in fact, 99% success rate in both mortality and production. Yes. So I would like to, if any of the members of this, if we can reach out to those people. I think after Hemocox, one other vaccine came up after it again, Lavacox. That one too was because when Hemocox came, we were giving Hemocox day five. We're using it at day 5. Then Lavacox came in. We are using that one at day 9. And all of a sudden, these two vaccines I'm talking to you now, they are no longer in circulation. I think the only one that happens to be on board now is that Hipracox by Breedware Company. I can't really place my hand on it at maybe whenever people want it. So if we can be able to reach out to some of those people who are really connected to this vaccine, let them look at it again and bring it back. It will really go a long way because the vaccine has helped me. I'm a practical person on that, and I've used it. It has helped me so much. So if we can use this platform to reach out to some of those people so that they can bring in these vaccines for us. And that's a comment I say, let me give. Thank you so much, sir.
Very good, actually. As I told you, I also use that Imocox. It's a wonderful vaccine. But I think along the line, the company, I don't think they did enough in terms of marketing. So most veterinarians or animal scientists were not conversant with the importance of that vaccine. So, and you know, most of these companies are after profit. And volume bring profit. The more you sell, the more you get the profit. So I think they are driven by volume, and they have less volume. Probably, I'm not taking hold for them, but one of the sales rep I was discussing with, actually, we had this discussion, and I think some of the factors, and now the dollar exchange and so many things. As I said, I'm not holding brief for them. But I think we need, over our MBMA conference, we have to bring those issues because they always attend such conferences. We have to know why. One thing they have to really do a lot of marketing and sensitization. Even in schools, they have to do a lot of sensitization so that people adopt the vaccine. And also they have to look of Nigerian poultry sector because mostly if you're having large dose vaccine, you find the smaller farmers that are more will not have the opportunity to use it. So they have to bring the number of doses down. Like the way they're doing, you see, most of the drugs now, they have 50, even the vaccines now, they bring it down, the other vaccines. Newcastle disease, for example, now you have 50 dose bottle, you have 100 dose, you have 200 dose, you have 500 dose. We even have 5,000 dose vaccine. So that means they have cut across the bigger farmers and the smaller farmers. For that Coccidiosis, I think that approach also they have to adopt it for the smaller farmers to use it and for bigger farmers to use it. And they have to do a lot of sensitization among the poultry family to see that people are using the vaccine so that they get their sales and their profit. But it's very good what you said is very correct. I use it personally when I was at BOM. Everyone among my clients, but it's no longer available now. So I think it's good, and I hope they will hear. I will forward this presentation to some of them that I know they will use it. Actually, I forgot to send to Ola Dotun, the one that moved now. Before he was in charge of the lab, but now he's in the University of Jos. He's with the University of Jos. Yes. I think I will send it in. I forgot to invite him for this presentation. I'm sure he will have joined. But I will send the presentation to him and he will hear. I'm sure he still have linkage with them. And I have many of my students that are their self-ref. Dr. Ibrahim, the one in charge of Kano Kasina, Sokoto, Dr. Ibrahim is also my student. And I have Dr. Adamu, he's in Kano. There are so many of them. And even they obey me animal care, I have access to him. I can call him and find out why are we not having that vaccine. It's a very good to help Nigerian poultry industry. Thank you very much.
Yeah, but what you know that with the death of Dr. Abato, animal care is scaled down seriously. Yeah, I think so that they can size within the shoe he left behind. I don't know how many of us who are in the world, many of us, or how many of us had attended or a member of World Veterinary Poultry Association.
Because maybe online.
No, I've seen Dr. Boala in one of the conferences. Dr. Boala came and gave some.
At MBRI.
Not from MBRI. Then he was in South Africa for his PhD. He came from South Africa.
Yes.
The last time they had meeting in Edinburgh. I'm trying to search and know when they will have the next. They are having the next meeting next year in 2027 because they normally have their meeting every 2 years. They are not 30th August to 30th August to 3rd September 2027 in Brussels, Belgium. I might attend that one. So, I've attended the one of in 2003. Yes, sorry, 2002 at Well, at Egypt, Cairo. Then the next one I attended was the one of 2003. I attended in Denver, Colorado. Actually, why it was one year in those years is because we were to have it in Egypt in 2002 on starting from September 11, and that's those bombs, bombing took place in US, and most of the resource persons were coming from US, so they moved it to February 2003. Sorry, they moved it to February 2002, and then in summertime 2003 we went to Denver, Colorado, and then the third one was the one I attended at Edinburgh, close to me here. So, but you see, such conferences, there are a lot of people you will meet. People like the late Dr. Edgar that discovered coccidiosis. He's late now. He's the one that from Auburn University. Meet a lot of people that you can ask them questions one after the other. Yeah, even after the plenary session or divided sessions, you can ask them questions on one-on-one. And then you can, for those of you in academic research, if they can accept your abstract, if they can accept your abstract, they will give, like they accepted the abstract of Dr. Boala. Dr. Boala came to Edinburgh. They paid for his accommodation, they paid for his feeding, they paid for his transportation, even if for poster presentation. And then you can be able to reach out to world-class researchers and being able to combine research, because there are a lot of funds flying in poultry research. A lot. So you can, some of you can from there migrate from one place to the other if you belong to such body. We started at the net in 1991 or so at the Port Harcourt conference. Wanted to start Nigerian Poultry Veterinary Association, and it ended up in cul-de-sac. Dr. Jones has started, and the thing is not. So what can we do to have a specialized, just like what the small animal practitioners are doing, Savan, have a replica of Savan in poultry medicine in Nigeria, and link up with our practices, our diseases, our disease control, research with the international body, which is the World Veterinary Poultry Association. This is a point to note, and then a point that we should address. I remember the one they had, it was Dr. Jai, formerly of Obasanjo Farms, that called me, that they went to Mexico, when Mexico hosted. Brussels is going to host, because every 2 years they will be recycling the conference, international conference. I think the last 2 times they went to South Africa. And one day we might even bring them here. There's a lot of money. But we need to organize ourselves here. So that is my advice I am giving to this body. As we discuss poultry diseases, I will continue to discuss this. So I'll be able to see in Egypt in 2003, February 2002. I think I went there with late Dr. Bayo and Dr. Malgui. 2 of them were in, you know them now. 2 of them were in Equa then from Jos. Then you were in Jos.
Yes.
2 of them. And that's all. Then I think in Denver, I met Professor Oladele, Mrs. Oladele, the one in Ibadan, not the one you talked about. She came, and then the one I attended at Edinburgh. Yeah, I mean, if not for visa refusal, over 12 vets would have come, but I saw three vets that came. So apart from me, so please let's call it a duty. I think we should What we do now, we should call Dr. Boala. How they were able to sponsor him, what he did. It's not a rocket science. And I believe it's not a...
Is Dr. Mubarak online? We have one, our Gino doctor here who is also big in the clinics there.
Yeah, okay. He can speak to us.
Dr. Mubarak
has he been here from when we started? Mubarak,
unmute yourself. He was not here. He was not here. He joined.
Okay. But at least Mubarak, the information, we pass relevant information.
Can you unmute yourself, Dr. Mubarak, if you can hear me?
Mm-hmm.
Can you unmute yourself?
Well, I don't know why Dr. Mbafo from Cameroon is not here, because she always follows us.
Okay.
Because the time I was discussing with Mbafo, that lady, she teaches parasitology in Cameroon, one of the universities in northern Cameroon. Then I was asking her questions, but she's not a vet actually, but she's lecturing in vet faculty. When I asked her her area, she told me parasitology. I Googled, I found out that this year meeting, the parasitologists, everything parasitology, including veterinary, anything, they're having their meeting conference in Canada.
Sorry, Chief. I have occasion by 12 o'clock.
So what I'm saying is that now she has keyed into that conference, and that's she's going. So please, let's key into international conferences. So I think we are rounding up. We have discussed everything we're supposed to discuss, and then we thank everybody for coming. Next week we are bringing, hopefully we are bringing Dr. Otto, who is the FAO.
Yes.
Yeah, you know him.
No.
Is the FAO? What do you call it? FAO disease control agent in Nigeria. He's from Rwanda.
Representative.
Representative,
okay,
yes.
Representative, yes. I saw one seminar he's to deliver yes, very soon.
Yes. So he might come. I'll call him today to see whether he's amenable. He promised he will be here next week, but we need to confirm by today. They are involved in to discuss aspects of zoonotic diseases as in control, as it relates to Nigeria, from Nigeria to FAO. Okay, as I think we are calling it a night. Thank you, Usman. You start preparing us for fowl typhoid, please.
Thank you, everybody.
Thank you.